Hi, welcome to the Physio Tribe. My name is Taher Dhuliawala, and I'm a senior neurological physiotherapist working at Physiofunction. In the last three videos, we talked about assessment and holistic management of patients with spinal cord injury. In this last and the fourth video, I will be talking about rest of the management for patients with spinal cord injury, and we will cover the respiratory side, the cardiovascular fitness, and relearning of motor tasks in patients with spinal cord injury. In the previous video, we talked about management of contractures, skin management, patient education, pain management, and today we'll talk about strength training. So in strength training, which is again, strength is a very important part of management of patients with spinal cord injury, and strength training can be done in means of resisted training. And to do the resisted training, you have to also look into how you will progress with weights or progress in the resisted training. Also need to consider how you will facilitate to improve patients' power as well as their endurance. And as we discussed in the part 3, that FES can sometimes be very important to improve muscle hypertrophy and also to improve muscle integrity. So something that FES, functional electrical stimulation, should be considered in management of patient with spinal cord injury. Now, next is respiratory management for patients with spinal cord injury, and preventing respiratory complication is vital in management of these patients, and depending on their level, care needs to be taken for preventing these respiratory complications. So if a patient has got cervical C1 C2 injury, they will have total loss of their diaphragm, so they will be on mechanical ventilation, and you need to take proper care for their respiratory complications. Even at C3 level, they might have mechanical ventilator, they might have some innovation for their diaphragm, and then so on. As the level increases, they are they might not, on C4 or C5, they might not need mechanical ventilator. However, you need to then start checking if the patient has got an active cough. If the patient has got active cough, then you need to teach your patient breathing exercises and manage that in the community from that aspect. Now, also one of the important aspect is endurance training. So patients in the community will be wheeling their self-propelling with their wheelchair, so this becomes important to work with patients so that you can help patients improve their endurance so that they are able to self-propel themselves for long distance, and that they don't have to rely on their friends and family or their carers. Again, this depends on the level of injury. You can even, your occupational therapy colleagues can suggest patients whether they would, if they're high cervical injury, if they would need a electric wheelchair, or if they are lower levels or thoracic injuries and below that, they might be able to self-propel quite easily by themselves. And so cardiovascular fitness could be done by the use of FES bike again, and usually I get my patients to do the FES bike either for upper limb or lower limb to improve their cardiovascular fitness. Also, if your patients are low level and they want to go into sports, you can even encourage your patient to look into wheelchair training rollers, where the wheelchair is fitted on those rollers and patient is advised to self-propel themselves at a different speeds. It works like a treadmill for the wheelchairs, and that way patient can improve their cardiovascular fitness. So relearning of motor task is a very essential aspect of physiotherapy as well as occupational therapy management. And when you are planning the management for patient, you need to start looking at the following things. So when the patient comes to us in the community or in outpatient, they have already been, most of the patients have already been to the acute have been through the acute hospital setting and have done that acute phase. So that point they should have already learned, looked into the bed mobility. But if not, then you can always help patient achieve further goals from there. So in bed mobility, you need to look at whether patient can do rolling in the bed, or can patient do long sitting. Now these things are important because in long sitting patient will be able to dress themselves, upper body as well as lower body, and if so, the occupational therapist colleagues can do a washing and dressing assessment with them in those positions. So from therapy point of view, you need to teach your patients these activities. And also, once the patient has done that, then can patient sit on the edge of the bed, and whether they sit on the edge of the bed with or without hand support, or with or without back support, and realistically looking at what patient can achieve considering their level of injury. Then comes your transfers, looking into whether a patient can transfer from bed to wheelchair, wheelchair to toilet, wheelchair to another chair, and whether you need to teach your patient to do a pivot transfer, or you need to teach your patient to do a banana boat transfer. And in again, banana boat transfer sometimes need to consider whether the length of the patient's arm, and whether how strong are patients up shoulder and triceps to be able to push themselves, and how much what kind of strength training you need to give to your patient. So the next comes your hand functions, and your occupational therapist colleagues can help patients with that, with splinting, with other exercises, and improving their hand functions. Then comes your wheelchair mobility and skills. So your occupational therapist colleagues, you can work with them on wheelchair settings, and providing patients with a very appropriate wheelchair for their level. And then you can work with patients with improving wheelchair skills like wheeling in the community. And then you need to look at whether patient can hold a glass of water, or a or a mug, and self-propel themselves in their house, how they're managing to do how they're managing to self-propel themselves in the community, and what all things you need to teach the patients, like how they are managing to open doors when they go to shops, or how patient is managing to go over a ramp or come down the ramp. So all these things you need to teach the patients. Can the patients go on the curb, or how, if the patient wants to drive, can the patient do a transfer from wheelchair to the car, and can they undo their active wheelchair and put in the car? So these are the things you need to teach your patients. Also, can the patient do a split level transfer from floor to the wheelchair? And I always get my patients to do that, again depending on the level of injury, because this is important. Some young patients with spinal cord injury would want to be on the floor to play with their kids, or to or sometimes even some patients want to do some patients have fall probably, and they might want to come back to their wheelchair independently. So these are the things you need to consider and see if that's something relates with patient goals, and how you will teach the patient that. um, I always teach my patients, always encourage my patients in standing, referring them for standing frames, and I suggest my patients to stand in a standing frame for 30 minutes every day. And standing in a standing frame not just helps them with, helps them a lot with their plantar flexor stretching, but also has other physiological effects of standing on them. And it just helps patient to be at a good, at an eye level height, so they can sometimes stand and do some upper body exercises, or even stand and work on do some work in standing, which some of my patients have done in the past. And if the patient is standing, now some patients with incomplete spinal cord injury would want to stand and work on their standing balance, which then you need to facilitate and work into their static and then dynamic balance. Some incomplete spinal cord injury patients would also want to improve their gait, so you need to re-educate their gait and look into assisted devices which they can use to walk with. Some of my complete spinal cord injury patients want to walk as well, and for them I have suggested them, or I have tried actually them in exoskeletons, and I'm quite fortunate enough to work with 3 exoskeletons in my clinic at Physiofunction. So I normally suggest my patients, and if that is one of their goals, I get them walking within the exoskeletons, which and they get other benefits, physiological benefits of being in the exoskeleton and walking. So this was the brief about the management of patients with spinal cord injury. So in this slide, I have briefed about the pathway to rehabilitation, looking at some points from subjective assessment, objective assessment, and the management. So this is what we've covered in the last 4 videos. So just a bit of summary of that. So I hope you all enjoyed listening to the last 4 videos, and if there's anything you would like to know more about, please make sure you comment below, and please do not forget to like all the videos, and also to subscribe to our YouTube channel. And if you want to hear more, we will be coming back next week with a different topic, and the next presenter is Samantha David, and we look forward to seeing you there.